Have a look at this, preparing for a challenging winter 2020-21. And this has been written by the Academy of Medical Sciences. Now, we haven't had this document too long. We have spent some time on it, and we're going to give you as much as we can in the news today, but there is so much more in it. So what does it kick off with in the executive summary? That July and August must be a period of, quote, intense preparation for our reasonable worst case scenario for health in the winter that we set out in this report, including a resurgence of COVID-19, which might be greater than that seen in the spring.
Now, when we look at this term, reasonable worst case scenario, we've got to consider the last time, or the first time we heard it used, which of course was Neil Ferguson's model. Didn't he initially say something like 5 million people dying as a result in the reasonable worst case scenario?
That's how the fear was kicked off.
Yes.
Right. So it goes on with this. The assumptions that we have made should be tested as new evidence emerges, including analysis of the evidence from the first wave, to enable prevention and mitigation strategies to be adapted and refined. I find this an extraordinary sentence. We're going to test what we've said to see whether it was actually any good in the second wave. The assumptions that we have made should be tested. So we've closed down the country. We've destroyed 20% plus of the economy on the basis of something which hasn't been tested. And they're going to wait till we get hit again in order to test their models. This is pretty sick stuff. Mitigation strategies should not pose further disadvantage to the most vulnerable in society. What does that mean, Mike? They're not going to kill as many elderly people in nursing homes, possibly. Implementation of prevention and mitigation strategies require enhanced coordination, collaboration, and data sharing between central and local initiatives. This is fusion. This is bringing all of the information together, the surveillance systems.
And we're already seeing clues to this, because the local authorities have been complaining bitterly that they aren't getting the data from central government, and they're pushing harder and harder they're demanding more and more data from central government.
Indeed. So chat box, somebody has just said this is an assault, and I would actually say I agree with that comment. This is a planned assault on the population of Great Britain, and it's pretty easy to see. So here are the challenges. The need for health and social care undergoes large seasonal fluctuations, and all of a sudden we're quoting from 2017-18. England and Wales experienced approximately 50,000 excess winter deaths, but we didn't hear anything about those, Mike.
No, that was influenza in that case, but no, we didn't shut down the country for that.
We didn't shut down,
and that's more people than they say have died from COVID, even
Indeed.
if you assume
we
that
didn't
the numbers are
start
correct.
wearing masks. We didn't stop people going into pubs. We didn't do anything. We just let 50,000 people die. But now we're going to have an experiment. We're going to have another round to see whether our proposals and models from the first round, which were chaos, we can use them again. 4 additional challenges have great potential to exacerbate winter 2021 pressures on the health and social care system by increasing demand on usual care as well as limiting surge capacity. So let's have a look at these as just bullet points. Well, what are they talking about with the challenges? A large resurgence of COVID nationally with local or regional epidemics. How do they know that? This is the question I'd like to ask, because we haven't seen the evidence for it at all. We see plenty of talk, but no evidence.
Well, they're guessing based on their worst case scenario.
Number 2, disruption of the health and social care system. Well, we know that's coming because they got it right the first time round, and presumably they're going to make it worse. Number 3, a backlog of non-COVID-19 care. Well, that's already in existence, so all they've got to do is nothing, and we're set up for that to become a fact. Number 4, a possible influenza epidemic that will be additive to the challenges above. What's this about, Mike?
Well, it is what they say. They're looking forward to an influenza epidemic which comes on top of COVID. Of course, it'll be very difficult to work out who's dying of which respiratory disease. that will allow all kinds of opportunities within the media.
So they can flip from one to the other depending on how the public mood is going. If the public are not responding, they can up the influenza. If that is not doing the job, they can switch back to COVID. Well, let's carry on. Here are the priorities for prevention and mitigation. It says there's a need for urgent preparation to mitigate the risks of a particularly challenging winter, including minimising community SARS-CoV-2 transmission and impact. Number 2, organising health and social care settings to maximise infection control and ensure that COVID-19 and routine care can take place in parallel. How they're going to do that is very interesting, because if there were to be a crisis, if they know that there's a crisis coming, that wasn't achieved at all this time round.
Well, it's no problem. They're going to do that by making sure people can't attend accident and emergency. So they've already announced that in Northern Ireland. They're talking about having to make appointments to go to accident and emergency in England. And of course, as many people have pointed out, that puts the so-called golden first hour at risk, in the sense that it's going to be very, very difficult to get emergency treatment unless you're taken to A&E by an ambulance. And of course, the amount of demand on the ambulance service is going to mean delays there.
Yeah. So let's add in number 3, improving public health surveillance for COVID-19 influenza and other winter diseases. So there's even more diseases going to descend on this country in 2020-21. But the key to it is that we've got to increase the surveillance of the population. So now we're really getting a clue for what's going on here. This is not about protecting the health of the nation. This is about implementing a public surveillance system. And number 4, minimise influenza transmission and impact. Now, before we just move on, I'm just going to go back to the source document, which I should be able to call up on screen for myself. And I'm going to say one of the things that they are looking to bring in is developing effective policies to maximise population engagement in essential control measures. So we're back on the applied psychology. And what is this going to include? It's going to include physical distancing, wearing face coverings in settings where physical distancing is not possible, regular hand and respiratory hygiene, high levels of hygiene in the home, heating and ventilation of homes, self-isolation, and participation in the test, trace and isolate program, and identifying and addressing structural socioeconomic barriers to adherence. And that will require engagement with target communities, and national and local consideration of a wide range of incentivisation levers, brackets, including financial. So now, Mike, we're talking about getting into people's homes, presumably, to see that you've got a clean, sanitised home. And if you don't do these things, apart from anything else, they're looking to bring in financial penalties. So this document is quite amazing. We'll dig into it deeper.
The question is then, are we getting any clues that this may be the case, that they're going to want access to our homes? Well, Alex, last week you highlighted this. Just remind us the background.
This is the Dutch press reporting on a rapidly evolving bill that has been drafted by the Dutch government that hasn't really hit Parliament yet for debate. But the first draft, probably as a kite-flying attempt, suggested that there would be searches of private residences to check up on whether people were staying 1.5 meters away from non-relatives, including foster children that they were looking after occasionally. And that has been scrapped from the bill. But of course, like all the other things we're discussing, it could come back at a sub-national policy level.
Absolutely. Okay, so that was the Netherlands. But then in Germany, we had this one.
And this was the town of Gütersloh, a town with a dark past, and to this day the headquarters of the Bertelsmann publishing syndicate that is basically the mediator of truth for the Germans. And this very same town of 100,000 people has got soldiers storming around it because it's Germany's Leicester. It's where there's a hotspot of cases, we're told, at the moment. So soldiers are storming around saying, you must stick this swab in your face and here are your test results.
Absolutely. So let's come to the Republic of Ireland then, and this is the Journal. Gardaí should call to homes of people who refuse to take COVID-19 test, TD tells the Doyle Committee. So this is Fergus O'Dowd, and he's saying that basically that there have been 1,314 people who have been located through track and trace, but have not turned up for a COVID test. And he said that Garda should call to their homes and ask them to take the test, as it's a serious public health issue. He said, I think it's a huge figure and you need to do more work on it. If it means that the Gardaí may need to call on them, you know who these people are. It's not a question that they're unknown. They are known people and you have their home addresses. I think the Gardaí should call on them and tell them that in the interest of public health, they should turn up for a test. This has had quite a response on Twitter with people asking where it's going to end. But again, let's just remind ourselves about the situation in the UK with public health officers who may direct, remove or request a constable to remove an individual to a place suitable for screening and assessment. This is the guidance from the Department of Health and Social Care and Public Health England. Let's remind ourselves that where will the person be taken for screening and assessment? This facility must be suitable for screening and assessment. This could be an isolation facility, an NHS facility, or any other agreed facility as long as suitable for screening and assessment. Perhaps it's going to be a Nightingale hospital. They can take your child, whether you are there or not. But they may only exercise powers on a child in the presence of an individual who's responsible for the child, or if no such adult is present, an adult that they consider to be appropriate. So basically anybody can come and take your children into the system at that point. But don't worry, because we'll always be given the opportunity to comply voluntarily with public health advice, except that if we don't, we will have that advice imposed upon us. So Alex, that seems pretty clear to me. There seems to be a European trend. This is developing right across the European continent, that your home is no longer your castle. You have no entitlement to a private life, and they can and perhaps will be breaking your door down if it suits them.
Well, it doesn't surprise me, Mike, that the Republic of Ireland is the common law jurisdiction that they're having a crack at first, because it is in some ways the most corrupted, even more than Scotland in many ways, as we've been reporting in our coverage for quite a while. But they're going to have a job on their hands because, of course, Bunreacht na hÉireann, the Constitution of the Republic of Ireland, is on a par with the United States Constitution in being one of the finest common law constitutions in the world. And I think this bears out what John Waters has been warning about for a while, that the section on fundamental rights in the Irish Republic's constitution is being systematically dismantled. We've seen the right to life and sexuality sections of that part of the constitution already undone. And now the relevant bit here is Article 40.5 of Bunreacht na hÉireann, which simply says the dwelling of every citizen, this is the Irish Republic, is inviolable, a good old English word, and shall not be forcibly entered, save in accordance with law. And of course, that is shorthand for what the civil law tradition would call an organic law, a statute that says here are the limits of what the state can do. So that's why what you read out has got mention of the Gardaí coming and saying you really should, you know. But it's very similar to continental police practice. De facto, they don't have all the power on the continent here either, even under civil law. A lot of this comes down to police being told in their training or imbibing from each other the idea that when you knock on the door, you don't go until you have strong-armed the person at the door into complying and letting you in, warrant or no warrant. Whichever jurisdiction or even whichever legal tradition you're in, common or civil, a lot of this is mere bluster. But it is certainly pan-European. I'm seeing a lot of similar things on the continent.
Alex, very briefly, because it's nearly past already and we've got a lot to get through here, but just as you were reading that little section out, it reminded me of the section from the Weimar Constitution, which Hitler got rid of in the 1930s. We seem to be running through very similar steps.
Yes, American patriots are saying it more clearly than others. You can have a very fine constitution, but if people have stopped bleeding for it and simply treat it as a piece of paper, if we've got state governors in the United States now saying the Bill of Rights is above my pay grade and similar things going on in all English-speaking countries, then what's the constitution worth? You know, the constitution ultimately is not the paper, it is the people who are prepared to stand up for their laws and customs.
Absolutely.
That's correct. Right, we've just come back to that document, Preparing for a Challenging Winter just to take a little bit of an in-depth look at how the thing was put together. But it says that this was done, the report was done at the request of the Government Office for Science, the Academy of Medical Sciences, established in June 2020, an expert advisory group chaired by Professor Holgate. And what are they looking at? A clear understanding of a challenging winter, an understanding of what this would mean for deaths, NHS capacity and social care, an understanding of what challenges this will present for surveillance, test, trace and isolate, and non-pharmaceutical interventions, plans being developed by policy operational colleagues to manage this. That's an interesting expression, isn't it? I wonder what colleagues they are. So the lead man is Professor Stephen Holgate. Here he is. Encourage people to have a look at him because he's an incredibly qualified man. I have no doubt this man is of an incredibly high intellect, but I did notice that he's a specialist on asthma, and yet at the moment there is nothing in the government's advice to help asthma sufferers with regard to masks. Other people appear, and encourage our viewers and listeners to research it themselves. This lady, Mandy Ruzenko, is actually working with a completely different group in the NHS, but supposedly in order to get the opinions of the public and people in the NHS and care services, get those opinions to the surface. So this is that section in the report. My difficulty is that when you get into this, they're not really dealing with the public as a whole. They've had Ipsos Mori in to do some workshops online. They've spoken to 36 people, but when you look at what's going on, they're not talking to the public. They are talking to a variety of organisations. Some of them are fascinating. Evolve really takes the biscuit because the funding starts with George Soros and then goes on and on and on and on with a whole range of organisations putting money in. We come back to this one, National Voices. This is inside the NHS again, and it's what the NHS thinks that they want. And it's got NHS Voices on COVID. So it talks about the general public, but actually when you look at the work they've done, you don't see it. They are independent, of course,
Good
Mike.
stuff.
The project was part funded by a core grant for the Department for Business, so it's clearly independent of government. And if we have a look at who is involved with their fellowships, well, we just happen to have the Chief Medical Officer, Professor Chris Whitty, and the government's Chief Scientific Advisor, Sir Patrick Vallance. So that's all okay. And if we just have another look at Professor Stephen Holgate, well, his name came up in this article for the Evening Standard, where a drug company is having great success and their drug has been fast-tracked through the system. He was the founder. He's still non-executive director of the company Synergen, and they've come up with a respiratory drug which is now being tested, and of course the COVID situation makes it an ideal testing ground for them. So half will be given the aerosol therapy and half will be given a placebo, and we can find the man praising, well, his own company. So here we are, the reduced immune response of those at most at risk of serious COVID-19 disease makes them ideal candidates to receive the drug to replace their interferon beta deficiency. And this is especially so because coronavirus is equipped to evade this first line of viral defense. So what is this man, what part is he playing as part of this team? Is he working for a private company? Is he working for the government? Is he working for the Southampton University? We've no way of knowing. Clearly there's a hidden hand at work. Clearly it's taking the country in a very dangerous direction. What can we do about it? Well, we'll say again to the thousands of people that are now listening to UK Column News, those letters and emails that can be sent out so easily challenging people in government, people in the public sector about what they're doing and why they're doing it, showing the inaccuracies, asking for evidence. These are immensely powerful things to do. And if we have enough people doing it, we will start to see those people falling out of the shadows, as it were. So don't sit there worrying about what's happening. start to take some action, because as we've said before, it's the action that conquers the fear. We'll leave it there. Thanks very much for joining us. Bye-bye.